Hey everyone, and welcome back to the deep dive. We're seeing more and more patients with high myopia these days, right? It's like a myopia boom out there.
Oh, it's definitely a growing concern for sure. And, with higher prescriptions comes a whole new set of challenges and considerations.
Yeah, exactly. And that's actually what we're going to deep dive into today, some really interesting research about how those dual focus contact lenses, the ones designed for myopia control, how they actually work in those highly myopic eyes.
You mean those prescriptions over NATA 6.000 diopters?
That's the one. We often just assume these lenses will work the same way for all levels of myopia, but this research kind of throws a wrench in that assumption.
Yeah, you hit the nail on the head there. And what makes this deep dive so fascinating is that we've got a recent study that looked very specifically at how dual focus lenses behave on eyes with high myopia. They even looked at what was happening in the periphery of the retina, not just the center.
Oh, wow. So it's like they were really trying to get the full picture.
Yeah, and to do that, they use this really cool tool called a pyramidal wavefront sensor.
A what?
A pyramidal wavefront sensor. It's a way to actually map out precisely how light is focusing on different points across the retina.
Oh, so it's like making a map of the eye and how light is hitting it.
Exactly. Think of it like a detailed topographic map, but instead of mountains and valleys, we're looking at how the light is bending and focusing.
Okay, that makes sense.
Yep.
So before we get too deep into the technical stuff, can you remind us why we should even care about high myopia? I mean, we know it's not just about needing thick glasses, right?
Oh, absolutely not. High myopia significantly increases the risk of developing some pretty serious eye conditions later on in life. Things like myopic macular degeneration or MMD.
MMD, that's the one that can lead to vision loss, right?
Yeah, potentially even blindness. It's a serious concern. And, projections are showing that by 2050, almost 1 billion people could have high myopia.
Wow, a billion people, that's a scary thought.
It is. And that's precisely why myopia control is so important, especially for these higher prescriptions. We're not just talking about clear vision today. We're talking about protecting their vision for the future.
It's like an investment in their long-term eye health.
Couldn't have said it better myself. And that's where these dual focus lenses come into play, right? The idea is that by having these plus power zones on the lens, we can create myopic defocus, which hopefully helps slow down how fast the eye grows.
Makes sense. But here's where things get a little interesting. This study actually measured how much myopic defocus those plus power zones were creating in highly myopic eyes. And guess what? They found that those eyes weren't always focusing as well as they should be, especially when looking at things up close.
Yeah, they were under-accommodating, which basically means their eyes weren't focusing strongly enough to see things clearly up close.
So it's like their eyes are kind of lagging behind a bit.
Exactly. It's what we call accommodative lag.
Yeah.
And here's the kicker. They found that this lag was worse in people with more myopia. So the higher the myopia, the more noticeable this focusing problem became.
Wow, so the more nearsighted the eye, the harder it is for those plus power zones to do their job. It's almost like they're fighting an uphill battle against this accommodative lag.
Yeah, it's a good way to think about it. So the question is, how does all of this affect what's actually happening on the retina, in terms of the defocus?
Right, because that's what we're really interested in, isn't it? How does that accommodative lag play out when we look at the retinal defocus?
Well, when they looked at distance viewing things, we're pretty much as we'd expect. The dual focus lens created about negno 2.00 diopters of myopic defocus.
Okay, that's good.
Right.
That's what we want to see.
Right. But when they started looking at what happens when you look at things closer up, that's when things got really interesting.
Is that where that accommodative lag starts messing things up?
You got it. Because the eyes weren't focusing enough for near tasks, they were actually ending up with some hyperheropic defocus, even with the plus power from the dual focus lens.
Wait a minute. Hyperopic defocus.
Yeah.
Isn't that the opposite of what we want for myopia control?
Yeah, it seems counterintuitive, right?
Yeah.
But even though the dual focus lens couldn't completely get rid of that hyperserpic defocus caused by the accommodative lag, it still did a way better job than just a normal single vision lens.
So it's still helping, even though it's facing this challenge.
Exactly. It significantly reduced the amount of hypersopic defocus. So even though those eyes were having a hard time focusing up close, the dual focus lens was working hard to kind of pull things back in the right direction.
So it's like a tug of war between the accommodative lag and the plus power zones.
Perfect analogy.
Yeah.
And remember, this whole battle isn't just happening at the center of the retina either. This study also looked at what was going on in the periphery.
Oh, right further out from the center where things can already be a bit blurry.
Precisely. And what they found there was fascinating. The further out they measured, especially at like 20 degrees off axis, the stronger that hyperosocopic shift became, especially in those eyes with higher myopia.
So those eyes are struggling to focus up close, and they're also dealing with more hyperosopic defocus in their peripheral vision. It's like a double whammy.
It definitely highlights how complex high myopia can be. But here's the good news. Despite all that, the dual focus lens was consistently creating more myopic defocus than a single vision lens. This was true across most areas of the retina, both in the center and in the periphery.
Okay, so even with all these challenges, the dual focus lens is still coming out on top.
Exactly. But, we've been talking a lot about the amount of defocus measured in diopters. I'm curious, what about the amount of light actually hitting the retina? Does the dual focus lens change how much light is focused versus defocused?
You mean like, is it changing the recipe of light reaching the back of the eye?
That's a great way to put it, and luckily this study looked at exactly that.
Oh, really? So how do they do that?
They used something called kernel density plots, which sounds very technical, but think of it as a way to visualize how much of the pupil is sending focused light versus defocused light to the retina. It's like taking snapshots of the light distribution at different distances.
Gotcha. So we're not just looking at diopters anymore. We're looking at the proportion of light that's hitting different parts of the retina.
You got it. And when they compared the dual focus lens to a single vision lens using these snapshots, the results were pretty amazing.
Oh, so tell me, what did they find?
Well, across all the distances they tested, the dual focus lens consistently reduced the proportion of hypertopic defocus and increased the proportion of myopic defocus compared to the single vision lens.
Wow. So even with those accommodative lags trying to push things the other way, the dual focus lens is still shifting the light towards myopic defocus. That's pretty impressive.
It is. But of course, there's always a trade-off somewhere. The dual focus lens didn't result in a slightly smaller proportion of perfectly focused light compared to the single vision lens.
Well, that makes sense, right? We're intentionally adding some blur with those plus power zones in order to try and slow down eye growth.
Right. A little blur now for hopefully much clearer vision in the future. It's a long-term investment.
A long-term vision plan. I love it. So what does this all mean for us when we're actually fitting these lenses on our patients, especially those with higher levels of myopia? What should we be thinking about?
That's the million-dollar question. And a great place to wrap up this part of our deep dive, we'll explore those practical implications and how we can use this research to make better clinical decisions in the next segment.
Awesome. We'll be back in a flash to dive into those practice pearls, so stay tuned. Okay, so we're back and ready to dig into those different zones in the dual focus lens. But before we get too lost in the details, can you remind us what exactly target vergence means?
Sure. So target vergence basically refers to where the eye is trying to focus.
So like when you're looking at something far away versus something up close.
Exactly. It's like aiming your vision at different distances. In this study, they actually looked at 6 different target vergences, ranging from looking at things far away to some very near tasks like reading.
Got it. So they tested how well those different zones were working at various distances. Makes sense. What did they find when they looked at each zone individually across those 6 target vergences?
Well, when they looked at distance viewing, things were pretty straightforward. The center zone of the lens, the one for clear distance vision, well, that created basically 0 defocus.
Okay, no surprises there.
Yeah.
Right. That's doing what it's supposed to.
Right. And then the first ring around that center, what we call the treatment zone, that consistently created about negative 2.000 diopters of myopic defocus.
Okay, so at distance, the lens is working as expected. The center zone gives you clear vision, and the treatment zone is providing that myopic defocus. But I'm guessing things got a little trickier as they move closer, especially that accommodative lag we talked about.
You're spot on. As those targets got closer, the eyes had to work harder to focus. And that's where those accommodative lags started to really have an impact.
So the closer you get, the more those highly myopic eyes struggle to keep up.
Exactly. And here's where it gets really interesting. The hyperopic shift, the one caused by the accommodative lag that underfocusing, well, that was actually more pronounced in the eyes with higher myopia.
So it's like the higher the myopia, the greater the lag, and the more hyperopic defocus.
It's like a domino effect. And that makes things even more complicated for the treatment zones because they're designed to create myopic defocus. But now they have to work against this hyperopic shift too. So did they find that the treatment zones were still making a difference?
Yeah, that's what I'm wondering about. Were they able to overcome that hyperopic shift at all?
They did. Even though they couldn't totally get rid of that hyperopic defocus, they were still significantly reducing it compared to a single vision lens.
So they were still putting up a good fight.
They were
Yeah.
trying to pull that focus back toward myopia. It's like a tug of war. The accommodative lag is pulling towards hyperopia, and the treatment zones are pulling toward myopia.
Oh, I like that analogy. It really
Ah.
paints a picture of what's going on. And it's important to remember that this isn't just happening at the center of the retina. They also measured how these zones were working in the periphery,
Mhm.
further out from that central focus point.
Yes. And what they found in the periphery is really intriguing. The further out they measured, especially at 20 degrees off axis, the more prominent that hyperopic shift became, especially in those more myopic eyes.
So those eyes are not only struggling to focus up close, but they're also getting more hypercopic defocus in their peripheral vision. It's like a double whammy.
It really highlights the unique challenges of managing high myopia. But the good news is that even with all that going on, the dual focus lens was still consistently delivering more myopic defocus than the single vision lens. And this was across most locations on the retina, both centrally and peripherally.
Okay, so it sounds like the dual focus lens is holding its own in this defocus tug of war.
No.
But we've been talking a lot about the amount of defocus in diopters. What about the amount of light actually hitting the retina? Does the dual focus lens change the proportion of light that's focused versus defocused? Like, is it changing the recipe of light reaching the back of the eye?
That's a great question, and it's actually something they looked at in this study.
Oh, really? So how do they measure that?
They used something called kernel density plots, which I know sounds kind of complicated, but basically it's a way to see how much of the pupil is sending focused light versus defocused light to the retina. Think of it like taking snapshots of the light distribution at different distances.
So we're not just talking about diopters anymore. We're looking at how much of the light is in focus versus out of focus.
Exactly. And what did they find when they compared the dual focus lens to the single vision lens using these snapshots? Well, the results were pretty amazing. Across all the distances, the dual focus lens consistently reduced the proportion of hypertropic defocus and increased the proportion of myopic defocus.
Wow, so even with those pesky accommodative lags, it's shifting that balance toward the myopic defocus. That's pretty remarkable.
It is, but of course there's a bit of a trade-off. They did find that the dual focus lens led to a slightly lower proportion of perfectly focused light compared to the single vision lens.
Well, yeah, that makes sense. We are intentionally introducing some blur with those plus power zones, right?
Yeah.
It's all in the name of myopia control.
Exactly. A little blur now for hopefully clearer vision later. It's all about the long game.
It is. So we've covered a lot of ground here. Let's recap the key takeaways for our listeners. First, high myopia is a growing concern, and we know it comes with an increased risk of some serious eye problems. So myopia control is becoming even more crucial, and these dual-focus lenses are a valuable tool in our toolbox.
They are. And this study really highlights that dual focus lenses don't always behave the same way in highly myopic eyes. We have to remember that those accommodative lags can really throw a wrench in things and can lead to some unexpected hyperotopic defocus, especially at near.
Right, those lags are always trying to crash the party.
Yeah.
But even with those challenges, the dual-focus lens is still the champion of defocus control, wouldn't you say?
Absolutely. It consistently outperformed the single vision lens and shifted that light balance towards myopic defocus. And it did this across different distances and even in different parts of the retina. It's like it's working over time to counteract those lags and the unique shape of a highly myopic eye.
So what does this all mean for us in our practices? When we're fitting these lenses on our patients, especially those with higher myopia, what should we be keeping in mind?
That's the million-dollar question, and I think it's a great place to wrap up this part of our deep dive. We'll explore those practical implications and how this research can help us make better clinical decisions in our next segment.
Perfect. We'll be right back to dive into those all-important practice pearls.
Mhm.
Stay tuned. Okay, so we're back, and we've talked a lot about the science behind these dual focus lenses and how they work differently in those highly myopic eyes. It's been a really interesting journey so far.
It has been. But now let's shift gears a bit and talk about how we can actually use all of this knowledge in our practices.
Yeah, let's translate all of this research into action. What are the take-home messages here? What can we do differently when we're fitting those dual focus lenses, especially on our patients with higher myopia?
Well, I think the biggest takeaway for me is that we really can't just treat all our patients the same. High myopia, especially when we consider those accommodative lags we talked about, it really demands a more tailored approach.
So it's not a one-size-fits-all kind of thing.
Exactly. We have to be more nuanced in our thinking.
So what does that mean in practice? What should we actually be doing differently when we're fitting those dual focus lenses on patients with higher prescriptions?
First and foremost, we have to be mindful of those accommodative lags, especially at near vision. We might need to be a bit more proactive in checking their near vision and making sure they're really focusing comfortably.
So don't just assume that just because their distance vision is crystal clear, they're also seeing well up close.
Exactly. We have to really take the time to assess their near vision and how well their eyes are focusing for those up close tasks. We might even think about incorporating some vision therapy technique.
Oh, that's a good point. Vision therapy can be really helpful in training those focusing muscles and addressing those lags.
Absolutely. Even just a few simple exercises can make a big difference for some patients, especially when it comes to their comfort when reading or doing other near work.
It's all about making those eyes work smarter, not harder.
Exactly. And of course, communication is key. We need to really explain to our patients why we're being extra careful with those near vision checks, especially if they're kids. We need to make sure their parents understand too.
Yeah, we need to set those expectations early on and help them understand that we're not just thinking about how clearly they can see today, but we're also looking out for their long-term eye health.
It's all about that long-term vision plan.
Right. And speaking of the long term, I'm guessing follow-up care is going to be super important for these patients too.
It's crucial. We need to monitor how they're responding to those dual focus lenses. That might mean scheduling more frequent follow-up appointments in the beginning just to make sure the lenses are doing what they're supposed to and that we can make any adjustments if needed.
So it sounds like we need to be more proactive, more attentive, and definitely more communicative with our high myopia patients.
We do. High myopia management is a team effort. We need to work closely with our patients, their families, and even consider collaborating with other eye care professionals, like vision therapists, to come up with a really personalized plan that takes into account their unique needs.
This has been such an eye-opening deep dive. I feel like I've learned so much about how to better manage my high myopia patients using dual focus lenses.
I'm glad to hear that. That's exactly what we hope to achieve with this show, to give you the knowledge and tools to provide the best possible care for your patients.
And I'm sure our listeners are feeling more confident about tackling those high myopia cases too.
I hope so. And if any of you want to take a deeper look at the research we discussed, be sure to check out the link to the full study. We'll have that in the episode description.
Great idea. And while you're there, if you enjoyed this deep dive, please do us a favor and leave us a 5-star rating. It really helps other people discover the show and join the conversation.
Thanks for joining us on the deep dive.
And until next time, keep those minds curious and those eyes healthy.